Good evening all. Today our class is about radius of upper limb, one of the important topic. Now we will discuss about radius. First we should know about the anatomical position, that means side determination. Already we have discussed in the last class while studying about humerus. We should know what is upper end and what is lower end at first while seeing the anatomical position of a bone. Okay, at the upper end there is head. Here it is head of the radius. This is head of radius. It is disc shaped. Now the lower end there is styloid process. Here this is the styloid process. This is styloid process. This is lower end. Next, close to the neck there is radial tuberosity. Close to the neck, and this is neck. Close to the neck there is radial tuberosity. This is radial tuberosity. Okay, I hope you all are understanding what I am saying. Tuberosity. Next, at the lower end there is two surfaces. One is anterior surface and one more is posterior surface. At the anterior surface there is a prominent ridge. At the anterior surface there is a prominent ridge, and at the posterior surface, and this is the posterior surface of lower end. This is posterior surface. At posterior surface there is four grooves. First groove, second groove, third groove and fourth groove. These are the four grooves, and there is dorsal tubercle of lesser. This is dorsal tubercle of lesser. Dorsal tubercle of lesser is present at the posterior surface. Anterior surface there is a prominent ridge, and posterior surface there is four grooves and dorsal tubercle of lesser. And shaft there is a medial border. At the medial border, and this is medial border. This is medial border. At shaft, the medial border of shaft is very sharp. Understood? The medial border of shaft is very sharp. Here we have completed the anatomical position of radius bone, one of the important bone in the upper limb. Now we are going to discuss about upper end. Okay. Now we are going to discuss about upper limb. Upper limb is one of the most important concept for 5 marks question. Upper end. Upper end is one of the most important concept for 5 marks question. Okay, now in the upper end there are three parts. One is head. There are three parts. One is head, and the second one is neck. The second part is neck, and the third part is radial tuberosity, and the third part is radial tuberosity. There are three parts at the upper end, and here is the upper end. Three parts: head, neck and radial tuberosity. While reading, let us discuss about head. Head is disc shaped. What? Disc shaped. We already discussed it. And it is covered with hyaline cartilage. Head is covered with cartilage called hyaline cartilage. Next, and at the superior, and here at the superior there is a concave shape like this. There is a concave shape like this. Okay, this surface articulates with the capitulum of humerus. We already discussed in the last class. Here this surface, it articulates with the capitulum of humerus to form elbow joint. Okay, this is about head. Head is disc shaped. It is hyaline cartilage, and upper surface of the head, it is concave shaped, and it articulates with the capitulum to form elbow joint. Now head fits into radial notch of ulnar to form radio-ulnar joint. Head, and this is the head. Head fits into here it is a radial notch of ulnar, and here it is ulnar. Ulnar has radial notch here. The head is fitted into radial notch of ulnar to form radio-ulnar joint. And we have completed about head, and this is neck. Now neck. Neck is enclosed by narrow lower margin of annular ligament. Head and neck can rotate freely within the socket, and here head and neck can rotate freely within the socket of capitulum. Okay, next, annular ligament. Annular ligaments are like this, which half filled with half of the head is covered and half of the neck is covered. Now radial tuberosity. Head is completed. Now we will study about radial tuberosity. And radial tuberosity, it is just laid just below the medial part of neck. Here it is the medial part of neck, just below the medial part of neck. And radial tuberosity, it is rough posterior part. Its posterior part is rough and anterior part is smooth. Its anterior part is smooth and posterior part is rough. Okay, and this is all about the upper end of radius. Now we are going to discuss about the lower end of radius, and lower end of the radius is the widest part of the bone. Lower end of radius is widest part of the bone. Okay, now lower end of bone has 5 surfaces. Anterior, first one is 5 surfaces. Lower end is also important for 5 marks question, very important. Now lower end has 5 surfaces. First one is anterior surface, second one is posterior surface, third one is medial surface, fourth one is lateral surface, and fifth one is inferior surface. Okay, anterior surface, posterior surface, medial surface, lateral surface, and inferior surface. Now we are going to discuss all about these 5 surfaces, and it is the widest part. Okay, now anterior surface. Anterior surface has prominent ridge and radial artery is palpated against the surface. At the anterior surface of lower end of radius, there is radial artery which is palpated. It is superficial. Radial artery is placed superficial to the anterior surface of radius bone. And here we can observe the pulsations. Here it is the radius bone, and this is thumb, and here we can pulsate the radial artery. We can palpate the radial artery. Okay, because it is placed at the superficial. Okay, and now the anterior surface. Only the anterior surface is as prominent ridge and radial artery which is palpated. Okay, only 2 points regarding with the anterior surface. Now the anterior surface is completed. Now the posterior surface. Posterior surface has 4 grooves, and here this is the posterior surface. Okay, we already discussed about these grooves. Posterior surface has 4 grooves. This is the first groove, this is the second one, this is the third groove. Third one is also called as oblique groove. Okay, third one is also called as oblique groove. And here it is the fourth groove. Okay, here this is the fourth groove. And at the posterior side there is dorsal tubercle of lesser. Dorsal tubercle of lesser, L-I-S-T-E-R. Okay, there are 4 grooves. Third groove is also called as oblique groove, and there is a tubercle called dorsal tubercle of lesser. This is all about the posterior surface. Okay, here this is the posterior surface. Now we are going to discuss about the medial surface, and this is the medial surface. There is ulnar notch. Okay, there is ulnar notch where the head of ulna is situated. Okay, the head of ulna is at the lower end. While studying, we will know it about while studying the ulna. Okay, ulna bone. The head of ulna is at the lower end. Here it is the ulnar notch where the head of ulna is situated or inserted like this. Okay, this is ulnar notch. This is all about medial surface. Medial surface, only one point there is medial notch. I mean ulnar notch. That's it. And at the lateral surface there is styloid process. This is the styloid process which is placed at lateral surface and lower end of the radius. Okay, styloid process. medial surface there is ulnar knots, and lateral surface there is styloid process. This is all about lateral surface. Okay, we have completed anterior surface, posterior surface, medial surface, and lateral surface. Okay, now we are going to discuss about inferior surface, very important in the radius of lower bone. This surface is very important. Okay, inferior surface, there is triangular area like this. Okay, there is triangular area which bears scaphoid bone. Okay, triangular area where the scaphoid bone, okay, where the scaphoid bone is placed. This is triangular area, and quadrangular area. This is quadrangular area where the lunate bone is placed. Okay, where the lunate bone is placed. Scaphoid bone and lunate bone, we will discuss about it later while studying about the wrist joint and while studying about the carpal bones. These two are carpal bones. Okay, these two are carpal bones, lunate bone and scaphoid bone. Triangular area which is fitted with lunate bone, and quadrangular area which is fitted with the lunate bone. I mean triangular area which is fitted with scaphoid bone, and quadrangular area which is fitted with lunate bone. Okay, this is all the part of this is all we have completed the inferior surface. Okay, inferior surface which helps in the formation of wrist joint. Okay, inferior surface, the wrist joints takes place at the inferior surface itself. Okay, now this is how we completed the lower end, anterior end, posterior surface, medial surface, lateral surface, and inferior surface. Okay, anterior surface there is a prominent ridge and radial artery, and at the posterior surface there are 4 grooves and a dorsal tubercle of lesser, and at the medial surface there is ulnar knots, and lateral surface there is a styloid process, and at the inferior surface there is triangular area which bears scaphoid bone, and quadrangular area which bears lunate bone. These bones are carpal bones. These helps in the formation of wrist joint. This is all about the inferior surface and lower end of the radius. Now we have completed the upper end and lower end of the radius. Now we are going to discuss about the clinical anatomy. Okay, clinical anatomy. First thing, the most important clinical anatomy. Clinical anatomy is important for 5 marks. I mean, which includes in the essay question, and clinical anatomy is very important in the viva section, and it is very important in the 2 mark section, very short answers. First we will discuss about the Colles fracture. Colles fracture occurs at the lower end. Okay, just about 2 centimeters of lower end. For example, here it is 2 centimeters. Okay, the Colles fracture occurs here in this spot. Okay, in this spot like this. Fracture we will indicate like this. Okay, at the 2 centimeters above the lower end there is Colles fracture. This is caused, the Colles fracture is caused due to fall on outstretched hand. Colles fracture, very important. Colles fracture occurs due to outstretched hand, fall on outstretched hand. This is Colles fracture. Next, subluxation of head of radius. Subluxation means subluxation. Spelling SUBLUXATION. It means సున్నితత్వం in Telugu. Okay, సున్నితత్వం, చాలా స్మూత్ గా ఉండటం, సున్నితంగా ఉన్నాడా కొడితే కందిపోయాడు అంటాం. That's we call it as సున్నితత్వం. Okay, subluxation means సున్నితత్వం. Subluxation of head of radius means it is mostly occurs in children. Okay, it is mostly occurs in children. I will provide the pictures of all these clinical anatomy. You can understand very easily. I will provide the pics in Instagram along with the notes. You can follow it. Okay, subluxation where the joint, elbow joint is dislocated. That means capitulum of humerus and head of radius is dislocated because of subluxation. Okay, it is mostly occurs in children. This is also called as pulled elbow. What? Also called as pulled elbow. PULLED, pulled elbow. Okay, this is the clinical anatomy. We have completed the clinical anatomy. This all about radius. Okay, yeah. This is our notes, radius, short notes. This is one page. and this is one more, and just clinical anatomy. That's it. This is all for today. Thank you all.